I'm really grateful to the organizer for providing me the opportunity to present my case in front of this august audience. So I'm going to present this case. I have named it as a nailing the ostium. I have nothing to disclose. My patient is a 53-year-old non-diabetic, non-hypertensive smoker with a history of drug refractory effort angina. His clinical evaluation was apparently non-contributory, whereas ECG showed some T inversion in precordial leads, and echocardiography revealed no RWMA with a preserved ejection fraction with a grade 2 diastolic dysfunction. And subsequently, I went for a coronary angio that revealed the critical left main ostial disease that I'm going to show. And because of some consent-related issues, he was deferred revascularization after 1 week. So this is the left system. You can well appreciate over here the critical stenosis of the left main ostium. And here is the right system. Apart from an intermediate disease in the PLV branch, there is nothing that significant. So 8 days after, he was readmitted for IVAS guided left main ostial PCI. And I went for a 7 French gel guide femoral route. And I crossed the lesion with a run through floppy and pre-dilated the lesion with a 2.5 into 12, followed by 3 into 12, and then followed by 3.5 into 8 millimeter NC balloon, even as much high pressure as possible. But unfortunately, even after the 3.5 into 8 NC with a high pressure, I couldn't find that the left main ostium could yield that much to my satisfaction. At that point, I went for the IVAS pre-run. It was an LED to left main IVAS with an OptiCross 3 French into 135 centimeter run. It is a 40 hertz IVAS system. And here you can see, this is from the mid of the LED. That's the diagonal coming in, and some amount of the concentric we can see over here. This zone, the plaque burden is not that significant. This is quite an healthy zone. The calcium is not that much of any significance. Significant plaque burden. This is the proximal LED. Now the LCX is coming into view. LCX ostium is not that diseased, but the LED ostium is very much tight and critical. This is the left main distal and shaft. You can appreciate the side wear over here around 9 o'clock. Now this is the LM ostium. It's quite a plaque burden for sure.